We present an all-in-sight remnant preserving PCL reconstruction. These are all disclosures. This is the MRI of an isolated PCL injury, and this is the posterior instability as evaluated under anesthesia. This is our setup for surgery. In diagnostic arthroscopy you can see the floppy ACL sign that confirms the posterior instability. This is the femoral insertion of the PCL. We mark and prepare the footprint of the AL bundle with the RF ablation, and then we use a drill bit as a femoral guide, freehand. So through that drill bit we advance the guide pin, and over that guide pin we prepare a full length tunnel 4.5 for the button and 20 millimeters in length socket for the graft. So now we move to the tibia side. This is the remnants of the PCL at the tibia side. We prepare the footprint without removing any remnants, and we release the capsule all the way down until we see the popliteus muscle. So now we're ready to introduce our tibial guide through the anteromedial portal. Now the scope is in the posteromedial portal. We check with fluoroscopy the position of our guide pin, and once the tip of our guide pin reaches the posterior cortex, then we're ready to introduce our special drill. We flip the reverse drill, and we're ready to create a 30 millimeters in length tibial socket. Now for the remnants preservation, we have to create a path for the graft through the remnants. We use the RF ablation for that, and the Kelly clamp or a dissector clamp to enlarge this space. And we use this dissector forceps to retrieve the subtle suture from the tibial socket and bring it through the remnants, as you can see here. Now we have to retrieve both femoral and tibia subtle sutures simultaneously, and the graft is delivered through the anteromedial portal and goes first to the tibial socket. Now once the graft passes through the remnants, then the scope is going to the posteromedial portal to control the entrance of the graft into the tibia socket, as we can see here. So then the scope goes back to the anteral portal to control the entrance of the graft into the femoral socket. So now the graft is in place and fixed with the buttons. Here is the final control. The scope is in the posteromedial portal and checks the graft going all the way down to the tibia socket. Now the scope is going to the anterolateral portal to check the graft into the nodes, and you see how it rests into the femoral socket. And this is the clinical presentation showing restoration of the posterior stability. The MRI at 4 months shows excellent graft healing and remnant preservation.